Good morning, ladies and gentlemen. This is Jess De Los Santos, and it is my honor to be your host for the 8th Breakout track of the Philippine Digital Convention 2020 entitled eHEALTH, brought to you by PLDT Enterprise, Smart and ePLDT, and co-presented by Salesforce and Multisys. We're excited to have you join us as we continue to help you discover how you can pivot your enterprise towards success to ensure lasting and effective change as we enter the new future of work. Truly, Philippine Digital Convention 2020 is set to be like no other, as this is the first all-virtual iteration of the convention, but as we like to say at PLDT, pivot or perish, and this virtual convention is but a manifestation of how we've transformed in light of the current business landscape. Likewise, we hope that it serves as a venue for you to find ways for your organization to continuously evolve. But before we get to that, we would once again like to thank our official event partners. Today, we will be taking a look at how rapidly telemedicine has evolved in the past years, from slowly rising in adoption rates to now being accepted as standard practice. With healthcare remaining a top priority, this session seeks to showcase the technologies that will enable healthcare providers and companies to deliver innovative solutions in a smarter and faster way. Defy limitations and borders as we bring technology and industry experts together with respected local and global leaders from various key industries across the region and the world together in this virtual space. But just because we're virtual doesn't mean that this year's session is going to be any less interactive or engaging. We would love to hear from you, so do share your thoughts and insights by keying them in the chat box or by posting them in your respective social media accounts with the official event hashtags, #BraceForImpact and #PHDigicon2020. Also get a chance to win exciting raffle prizes just by answering our feedback form, which will be made available after this session, so stay tuned for that. And now to share how technology is impacting the delivery of healthcare and how the technology sector will gradually invade the healthcare supply chain, our first presenter is a highly respected equity analyst from the investment banking sector. He has studied the TMT sector for the last 25 years and currently leads the development of Global Data's thematic research ecosystem. Get ready to experience impact as we start off this session with Global Data's Head of Thematic Research, Mr. Cyrus Mewawala.
Thank you, Jess. Today I'm going to talk to you about how technology is impacting the delivery of healthcare. The global healthcare market is currently worth about $8 trillion and is growing annually at 4% per annum. For hundreds of years, the key drivers of progress in healthcare were biology and chemistry. Today, they are data science and software. The slide you're looking at highlights the primary ways in which technology is changing the delivery of healthcare. There are typically 5 stages in the delivery of healthcare: prevention, diagnosis, treatment, monitoring, and recording. And technology is transforming each stage. In prevention, in the past, the focus was on cures rather than prevention. In future, the focus will be on prevention made possible by genetic profiling and network biosensors. In diagnosis, in the past, the process of diagnosing a health issue might take weeks and would involve several clinicians conducting a multitude of tests on patients to collect several samples of data. In future, diagnoses will be made by analyzing large data sets, often in milliseconds. When it comes to treatment, in the past, doctors would adopt a one-size-fits-all approach to treat many medical conditions. In future, by contrast, there'll be a focus on precision medicine. In monitoring, in the past, patients were required to undergo long stays in hospital while being monitored. Once home, they'd have to visit clinicians regularly for checkups. In future, remote patient monitoring and telemedicine will cut costs and improve patient outcomes. And finally, in recording, many medical records today are paper-based. In the future, they'll be digital, and health systems will become more integrated across the value chain. 10 enabling technologies are set to transform the healthcare industry value chain over the next 2 years. The most important ones are genomics, which is likely to become the most lucrative segment of the biotech sector, Mobile health, which includes medical sensors and health and fitness apps. Robotics, which encompasses surgical robots, exoskeletons, care robots, hospital robots, and even 3D printers. Telemedicine, which refers to the remote diagnosis and treatment of patients using collaboration tools. And cybersecurity, which becomes of paramount importance as more patient diagnostics and data is digitally stored in the cloud. The healthcare industry has been slow to move away from traditional business practices and is dominated by long-standing incumbents. Many of the old players are now facing new threats coming from multiple technologies that are likely to disrupt the way that care is delivered. This slide illustrates the supply chain for the healthcare industry and how it might change in future. Insurers, physicians, pharmacies, and hospitals will likely continue to deliver many healthcare services. But in future, several technology players could be added to the list, including genome sequencers, cloud infrastructure providers, artificial intelligence engines, and app developers. Drug makers and medical device makers could still provide much of the equipment and consumables to healthcare providers. But in future, several technology providers could be added to the supplier list too, including medical sensor makers, wearable device makers, robot makers, and biometric clothing makers. Over the next 10 minutes, I'm going to focus on 6 key technologies and how they are set to change healthcare forever. And that is medical sensors, wearable tech, health and fitness apps, virtual and augmented reality, telemedicine, and cyber security. So let's start with medical biosensors. Medical biosensors are likely to become ubiquitous within the next 10 years. They facilitate diagnosis and treatment by monitoring an individual's physiochemical makeup. Biosensors can be used as cardiac and cancer markers or to monitor cholesterol and glucose levels. In the future, we will see more embedded and ingested biosensors, but wearables will likely dominate the market in the near term. Medical biosensors have the potential to improve health outcomes while allowing the system to cut costs as a result of early diagnostics, personalized treatments, and treatment adherence monitoring. Let's look at a couple of real-world examples. The first is from Otsuka. In late 2017, Otsuka's Abilify MySight became the first FDA-approved drug with a digital ingestion tracking system. And this drug represented a new era in digital innovation. Dosing, adherence to medication, and activity levels can all be monitored by the physician. Compliance is a notable challenge for patients taking antipsychotics, and Abilify MySight aims to address this unmet need. In the second example, research at Binghamton University developed a new biosensor that mimics the skin's properties to aid in wound healing. The new biosensor is designed to track and analyze lactate and oxygen on the skin and hopefully allow clinicians to monitor wound healing in real time. Our next theme is wearable devices. Wearables are non-invasive, autonomous devices that capture, analyze, and aggregate physiological data to improve health and well-being. Wearable tech has been almost exclusively used in the past for fitness, but new healthcare use cases are emerging within the medical arena. The benefits are reverberating across the entire healthcare value chain, helping to improve precision medicine, early diagnosis, remote patient monitoring, adherence to medication, information libraries, and better decision-making, whilst at the same time reducing healthcare costs. In addition, growing demand and improved functionality has garnered the attention of health insurers who are incorporating them into their risk assessment processes. Linked to wearable devices is our third theme, health and fitness apps. Today, health and fitness apps are predominantly a consumer phenomenon. However, a number of use cases are emerging for the use of health and fitness apps in the medical arena. Many traditional healthcare IT companies have entered this space. Allscripts, for example, provides medical information apps and is transitioning many of its offerings to the mobile space. Epic Systems, another healthcare IT company, is also entering the space with a focus on mobile apps. Other major players in this market include AliveCore, Cardio, Dexcom, Medtronic, Abbott, Philips, and Butterfly Network. But big tech is also entering this space. Apple is quickly overtaking the diagnostic testing app market with heart sensors connected to its Apple Health app. Its latest smartwatch, the Apple Watch Series 6, can even measure blood oxygen levels. As long as Apple continues to develop biosensors and associated apps, it will continue to dominate this market. Next, we have virtual and augmented reality. VR technology aims to immerse the user in an entirely artificial world, which has the illusion of reality. AR technology, by contrast, allows the user to see the real world overlaid with a layer of digital content. Virtual and augmented reality technologies have been traditionally associated with the entertainment industry, with virtual and immersive environments used for gamers, product designers, and even architects. But now there are many healthcare use cases. Take behavioral health. Cognoa's superpower glass intervention aims to improve social behavior of children aged 6 to 12 with autism. In drug discovery and R&D, Novartis has partnered with Nanome in 2016 to design a collaborative virtual world for drug discovery. In medical education, also VR has created a virtual reality platform designed for surgical training in order to improve patient outcomes, increase adoption of higher value medical technologies, and democratize access to surgical training. And finally, in mental health, the UK's National Institute of Health and Research has partnered with Oxford VR to produce the first large-scale, multi-site trial to test VR therapy for psychosis. Now let's switch to telemedicine. Telemedicine increases patient access to those who do not have a doctor nearby or are unable to travel. The benefits of telemedicine have been widely touted for many years. For patients, these include improved access to care, particularly for those living in rural or isolated areas. Another benefit for patients is access to affordable care, particularly for those without health insurance. During the COVID pandemic, the value of several of these benefits has become more pertinent, particularly reducing exposure and risk to infection for patients, their families, physicians, and other health workers too. Other important benefits for patients during the pandemic include not having to travel and improved access to care during lockdown measures. For physicians, telemedicine ensures that they can retain revenue when patients cannot come to in-clinic visits, and it also allows them to easily monitor patients at risk. Telemedicine is still in its early stages. By 2018, as this chart shows, telemedicine only represented 0.14% of all medical claims in the US. But between 2014 and 2018, this telemedicine market grew by 624%. We have witnessed unprecedented demand for telemedicine during the pandemic. Data from Global Data Survey of Healthcare Specialists in the US, which was conducted in June and July 2020, shows that pre-COVID, less than half of surveyed specialists indicated that they were using telemedicine. 30% of US physicians were using it in just 1 to 20% of their patients. In the same survey, 79% of specialists indicated that their use of telemedicine had increased as a result of the pandemic. 29% reported an increase of between 80 to 100%. With the emergence of the Internet of Medical Things, the industry is more vulnerable than ever to data breaches and sabotage. In 2018, there were 750 healthcare breaches, which equated to 15 million medical records, triple the number in 2017. In the first half of 2019, the number more than doubled to 32 million medical record breaches. Cybersecurity is now central to the healthcare industry's future. So I'll leave you with a few final thoughts. In terms of COVID's legacy, some of the changes brought about or accelerated by the pandemic are here to stay. 75% of US physicians say that they will continue to use telemedicine and remote patient monitoring even after COVID is long gone. Competition from big tech, companies like Apple, will continue to expand into the healthcare industry. Big tech started by offering non-medical consumer health products, but is now stepping into medical areas like diagnostics. One size does not fit all. When you're choosing the right technology solution for your business, there's a lot of options on the market and not all of them may be right for you. Don't be distracted by pretty new things. And finally, make sure you invest in cybersecurity. Failure to collect, store, and adequately protect customer data will damage your brand, your revenues, and your profitability. So thank you for inviting me again. It's great to be here with you. I hope you found these comments insightful, and I look forward to seeing you again at the Q&A session. Thanks.
Those were very good insights, Mr. Mewawala. Our next speaker graduated from Wheaton College in Norton, Massachusetts. He also holds a master's degree in business administration from the Ateneo Graduate School of Business. He has been with PLDT Group for 12 years, starting as a relationship manager to being the youngest corporate relationship management head in PLDT Enterprise. He also joined SPI Global Incorporated as head of IT service operations and transformation for Vietnam, China, India, and the Philippines. To walk us through the evolving eHealth and an overview of the latest technologies accelerating change and transformation, please welcome Corporate Relationship Management Head of PLDT Enterprise, Mr. Luigi Casas.
Good morning, everyone, and thank you again for joining our healthcare industry breakout session. Thank you, Cyrus, for the latest updates on the global trends and how it is shaping the healthcare industry today. Truly some very interesting pieces of technology that we can look forward to. So while Cyrus has painted a picture of what we can expect in the global scale, let's get into the local scene and see what's in store for the Philippine healthcare. And in order to put into context the technologies that will shape the industry, let's first set the stage and take a look at some of the local statistics and challenges. There are approximately 90,000 nurses and 41,000 doctors based on the Philippine Statistical Yearbook. Now, those numbers would seem large, but remember, we are an archipelago of a population of almost 110 million Filipinos. And we have to take into account location, skill level, and if these frontliners are actively practicing. If you look quickly at the healthcare facilities in the country, we are roughly 1,500 hospitals, more than 50% being private. And what's important to note is the 23,000 health stations located in the barangays. So stories from the ground really highlight two major challenges: the strained healthcare workers and the lack of medical resources. Despite there being over 150,000 combined nurses, doctors, and frontliners, there is still an estimated shortage of nurses at around 23,000. This is because the Philippines is known for being a great training ground, but better pay options outside lead to brain drain. With regard to the lacking medical resources, we have seen in the news the limited supply of hospital beds and testing facilities. Early this year, pharmaceutical firms struggled to meet the demand for medical equipment and were hampered by supply chain movement. There have been success stories out there, though. We have seen local IT companies, businesses, and conglomerates step up and assist the healthcare industry. Companies like Multisys, who created StaySafe.ph, a community-driven contact tracing and reporting app that was launched very early this year, and MWell, in partnership with Metro Pacific, who will be launching telemedicine solutions by the end of this year. These companies are a couple of local companies who are already in talks with local hospitals and clinics, and we will learn much more about them later in detail today. Telcos like PLDT have been active in launching hotlines and collaboration solutions for medical consultations. And last but not least, there has also been significant interest in cybersecurity solutions, as the healthcare industry continues to be the target of hackers to gain personal and financial data. Lastly, there has been an increase of online payments and delivery of medicine through IoT apps, as more people choose to stay home and migrate to cashless modes of payment. With that being said, we will see technology to be at the driving force and assist the frontliners and the healthcare industry, and more importantly, save lives. We in PLDT joined the healthcare industry's rallying call to make quality healthcare services available to all Filipinos, wherever and whenever they need it, and with whatever media they use. So we will be looking at a new normal of telemedicine and teleconsulting, as doctors will increase work from home activities and rely on secure internet connectivity combined with cybersecurity and video conference solutions to have patient visits moving forward. So much so that the DOH has already mandated that telemedicine solutions be the initial point of contact for both COVID and non-COVID related consultations. So there are really three core missions that we need to achieve in order for us to attain healthcare for all. The first mission is to provide safe and wide access to healthcare, no matter where you are. The second mission is to create better patient outcomes with smarter use of patient information and new tech-based practices. The last mission to tie these two together is really the need for a secure and efficient healthcare system that can integrate with both medical and non-medical platforms. So with those missions in mind, it's obvious that technology will play an important role in fulfilling healthcare for all. For wider access to healthcare, we will see the end-to-end telemedicine solutions taking the forefront here. These telemedicine solutions will allow not just booking and scheduling online consultations, but also e-prescription, payments, and remote monitoring. Technologies that will shape patient outcomes will really focus more on document management systems, but more importantly, cybersecurity, in order to protect patient data. Lastly, other technologies like medical database and hospital management systems will play a major role and focus for healthcare institutions. So to put it all into context, this is the baseline of what we stand to see in the new normal. Patients being able to set appointments in other ways aside from phone or email, but really through omni-channel means. In this example, a patient starts their journey through an assisted start via hotline, or they can do it self-service via a web or mobile app. At the end, both options will converge into the teleconsultation proper. But the journey doesn't end at the teleconsultation. Patients may receive a digital prescription or a referral slip for additional tests, and he or she may even send prescriptions in advance to partner drugstores to pick up medication or have it delivered. Added to this, patients may also send referral slips in advance to schedule a test to partner labs or centers. Telemedicine solutions like this should also be able to integrate with HMOs and PhilHealth in order to make patient, employee, and employer life much simpler in the long run. Last but not least, patients may avail of hardware solutions that can track and monitor their health regularly. So remote wearables is something that we see to be a big thing in the foreseeable future. We have seen companies like Samsung, Apple, and the likes develop items like the Apple Watch or the Fitbit to track your health. But remote wearables like the AccuCheck, specific for tracking and monitoring diabetes, is an example of medical grade wearables that are available today. So very quickly, these are the three main business models of telehealth. The first is B2C, or business to consumer, where a person can just download the app and be charged per consultation. The second is business to doctor, where it's usually a revenue share between doctors and telemedicine developer. And last but not least, it's business to business, which is usually a subscription model. So I'm actually very, very excited to announce that by the end of the year, the PLDT group will be launching its eHEALTH solution, which can do everything that we mentioned in the digital patient journey, from online consultation bookings to payments, digital prescriptions, and even lab referrals and notifications. This solution coming soon will cross beyond the limits of the physical office and alleviate the hospital crowd. It will really align to fulfilling the mission of providing healthcare anywhere, anytime, and from any device. The eHealth solution is just the tip of the iceberg, though, for Philippine healthcare. Don't forget, in order for any mobile app to work or eHealth solution to work, we will still need a secure and reliable connection and telco infrastructure, together with the right security tools in place. We will see these more in detail later today when we delve into the specific products that will shape the industry. So at the end of the day, what these technologies aim to do is to digitize the healthcare workforce, healthcare institutions, as well as the patients themselves. This is a vital part of the new normal, the adaptability of the general public and all industries to the digital transformation. The healthcare industry has a daunting task ahead. Only through digital solutions like telemedicine, remote monitoring, digital payments, with solid reinforcement by telco infrastructure from both fixed and wireless and cybersecurity, can our frontliners truly take on this task to reach all 110 million Filipinos across the country. With the right tools, technology, and motivation, the Philippines can make its way towards having a world-class healthcare system accessible to every Filipino. Last but not least, I know we have some folks from the healthcare clients and partners and even some frontliners watching today. And I would like to take this time on behalf of PLDT Enterprise to thank you all for the support you have given us since the start of the year. Thank you for taking care of our friends and families. Thank you for your grit and determination. And we will continue to pray for your health and safety. Back to you, Jess.
Thank you for your presentation, Luigi. Now to dive right into digital solutions for health, our next speaker is an epidemiologist at the World Health Organization Office for the Philippines. He has over 13 years of experience at WHO, focusing on tuberculosis, leprosy, rabies, and health emergencies, including the COVID-19 response. Now let us all welcome COVID-19 response team and technical officer for tuberculosis, World Health Organization, Mr. Tom Hyatt.
Thank you very much, Jess, and good morning, everybody. It's great to be with you. A few weeks ago, I sat down to unbox my new cell phone. Some very clever designers have orchestrated that entire experience. From the beautiful box that it comes in, to the sleek black screen, to the perfectly fitted accessories, it made me feel like I had taken a time machine into the future. I sat at my desk as if I were like a 6-year-old sitting under the Christmas tree. In awe, I turned on my new phone, and the experience seamlessly transitioned from the physical world to the virtual. My phone greeted me kindly and then effortlessly synced everything from my previous phone. As I browsed the capabilities of this new phone, I saw exposure notifications. So this is a new feature which was famously created by the unlikely partnership of Apple and Google. The feature tracks your proximity to other phones nearby that also have this feature turned on. Now, have you ever had a moment where you're thinking, whoa, I'm in the future here? This was one of those moments for me. So am I to understand this correctly, that this feature can track my movements and it can track other phones that have been in contact with me, mirroring the potential paths a virus like SARS-CoV-2 can take to hop from person to person? Is that right? That is amazing. My amazement continued as I looked at the other health apps, my personal health profile, my emergency contacts, allergies, blood type, the ability to sign up for organ donation, tracking of steps, sleep, meals, and more, an expansive personal health record that can bring in my health data from various clinics and hospitals. Wow, welcome to the future. I'm an epidemiologist at the World Health Organization. At WHO, we are interested in improving all aspects of health for all people. This includes people in every far-flung corner of the world. This includes people of all different abilities, cultures, and backgrounds. This includes people who can't afford basic necessities, much less a fancy new smartphone. At WHO, we've been working on the health of humans for 72 years, long before the cell phone was invented. Whatever the era, we've always thought how to use the latest technologies to save and improve lives. I met Maria a few years ago in Cavite. I've changed her name and face to protect her identity. She was diagnosed with drug-resistant tuberculosis. Now, if you don't know, this disease is a killer, literally. And the treatment is so difficult, for some it's as bad as death. Every day during her treatment, Maria would wake up, go outside her home, hail a tricycle, ride it to a waiting shed, to then connect with a bus and commute to a hospital 2 hours away. This was the only place her drugs were available. These drugs were so expensive and the regimen so challenging that health workers were required to observe every pill that went down Maria's throat. These drugs had horrible side effects, but they were the only things that could take on these mutant superbugs. It was a morbid game of who could kill whom first. And after that day's microscopic battle, Maria would again board a bus to take a tricycle back to her home again to rest. Same thing the next day and the next. Maria continued this not for a week, not for a month, but for 2 full years. She finally finished her last drug and was declared TB-free. The sheer tenacity of patients like her amazes me. Later, her son Danny was diagnosed with the same drug-resistant bacteria, but this time it was different. The drugs were not much better, but the hospital now had the ability to oversee his treatment digitally from a distance through a computer screen. He no longer needed to commute 4 hours a day to get well. It was still an immense undertaking for him, to be sure, but far more manageable than for his mother. Would he have given up if he had to do what his mother did, or did digital technology actually save his life? Now, I love the work you all do in digital technology because you live in the future. You design not just the apps and features, but the entire architecture and standards that the world will function in digitally. And so what about health? Our health and that of others. I might say that the improvement of the health of others, or public health, is one of the most noble pursuits we can follow in our time here on Earth. What can we do to help the Marias and Dannies of the Philippines and of the world? Earlier this year, I requested the telecom providers of the Philippines to give free access to COVID Kaya, the COVID-19 information system of the Department of Health. They enthusiastically supported this initiative. Along with their partners, they stood at the ready to help in any way they could to combat this pandemic in the Philippines. That is impressive to me. These organizations offer their unique strengths and abilities for a greater cause. Now, please take a moment to reflect on your own company or organization. What can you contribute? Perhaps it is increasing internet coverage to the furthest corners of the country rather than just focusing on the densely populated urban centers. The United Nations Development Program is helping the Department of Information and Communications Technology to roll out free Wi-Fi to 6,000 last-mile communities across the country. Imagine how that will save and improve lives. Perhaps you're expanding telemedicine options, as was mentioned earlier, so the elderly can get the care they need without the risk of being infected. Telemedicine partners of the Department of Health are making this a reality. CU Doc, Cloud PX, and Health Now PH are a few examples. Maybe you're helping to reorient personal health data so the patient owns and controls it rather than the hospital. You know best what you can do. And when you see the limits of what you can do, I encourage you to look just beyond those limits. What would be a stretch, a risk, maybe even a loss, but would be a public benefit to your fellow humans? Find out and then find a way to go for it. I'm sure you can, saving lives and improving them at the same time. Now, just a word of caution, a plea actually, as you develop the next big thing, whatever it is, please consider the health of your clients and customers, especially their mental health. We've learned a lot in the social media era. If we could go back to 2003 at the beginning, maybe we'd design things differently. Maybe we'd make the like button a bit less addictive. Maybe we'd make the comparison with other people not as easy and abundant. Maybe we'd set limits on the way other companies use our platforms to ensure healthy customer engagement that's not excessive. We learned long ago that the way newspapers report suicide can lead to more suicides or fewer suicides. We're just starting to learn these lessons now for social media. Again, as you create tomorrow's digital solutions, please keep health in mind. Consult WHO guidance on screen time for children, the dangers of a sedentary lifestyle, gaming disorder, and many other applicable references. See how you can orient toward better health instead of away from it. When you do, you may be an unsung hero, as no one will know just how bad it could have been. But that is the way of public health. No one knows all the pandemics that didn't happen. But you'll know, and your people will know. And I believe in the long run, your customers and clients will feel that you fundamentally care for them, even if they don't quite know why. So your role is twofold: digital solutions for health and health in all your digital solutions. So what will 2021 look like for digital health? 2025, 2030? How will we take on threats to health big and small? Tuberculosis, HIV, new diseases like COVID-19, traffic accidents, heart disease, cancer. What digital tools will be available to doctors, nurses, and patients thanks to your efforts today? It makes me excited just thinking about it. Saving people's lives and improving their lives at the same time. Can anything be more meaningful than that? Thank you very much for your time. I look forward to having more discussions with you in the Q&A.
Thank you, Mr. Hyatt. That segment was very insightful. Up next, here to also share with us digitalize the improvements within his organization is a senior advisor for healthcare at the Metro Pacific Investments Corporation, Mr. Daniel Horan.
Thank you, Jess, and good morning to all of the delegates, and welcome. It's a wonderful opportunity to be here with you. At Metro Pacific, we've been looking at digital technologies, in particular for the health sector, for a little bit now. And we really recognize the opportunity that digital improvements can provide to the health sector and also to the patients themselves. Ultimately, what we should be able to do is deliver better health outcomes at a much lower price or lower cost. Now, there are three areas that we see as fundamental in the digitizing of the health sector. Firstly, the experience level. Second, operationally. And third, through innovation. And I'm going to share with you in a few slides now what these are. So when we start looking at the journey of the customer and the experience, this is critical. The experience of the patient and solving their problems from a customer's perspective is what we're focused on here. So we first look at the customer journey end to end, from beginning to end. And an example of this is if you took pregnancy. Pregnancy is something which you can look at from a journey perspective, where you start from pre-pregnancy through to being pregnant, obviously, trimester 1, trimester 2, trimester 3, and then ultimately to delivery and beyond. Throughout that period, the patient, in this case, has many different interactions, both physical and virtual, throughout that journey. Now, we've been mapping these journeys out to understand more clearly where the patients have pain points and problems throughout that journey, interacting with the different elements of the health ecosystem. And what's critical for us here is that once we've mapped that out, we're actually able to digitally create an experience and a journey for that customer that provides them that end-to-end experience and delivers what is really important to them, which is the ultimate outcome. So we've been very focused on that. Now let's move to the operational level. In this focused area, what we're able to look at and improve on are things like efficiencies, driving cost out of the ecosystem, creating new business models, and using real-time information to improve the experiences for both the provider and the patient themselves. A very simple example of this is just customer identity. I'm sure many of you've been into environments where you've had to provide your identity numerous times in the check-in process of a service being provided to you. These sorts of things where we have digitally connected companies can actually be done in the scenes behind the scenes, for patients and the providers themselves, driving out efficiencies and ensuring that a speed of access to care is at an utmost importance there. And in doing so, the benefits that we can drive from this in a very simple way is for the patient, a simpler check-in process, and for the provider, it saves time, and time obviously equals money. I can put more people through a service if I can do it more efficiently. So we can see lots of benefits across the operational side of things for the providers and the patients. The final area that I'd love to talk about when we're digitizing is innovation. And in this area here, we have a huge range of things that we can bring to improve the health ecosystem. When you start to look at things like AI, machine learning, these are amazing technologies that can improve the customer's experience, but also introduce a whole range of new services. So as an example, digital triaging and AI triaging. This gives us the ability to remotely triage a patient prior to getting to care, ensuring that they get to the right appropriate care faster, more efficient. And this sort of thing gives a much better health outcome for the patient. And it will also give to the providers of the care a much more efficient and simpler way of providing service to the customers as they need it. Another example here is remote care, something which when you start to think about Internet of Things and wearable devices and the like, there's so many different things that we'll be able to do in the future which relate to preventive care, chronic disease management, and many other aspects of the health ecosystem that really can deliver huge benefits to the patients and also to the providers themselves. So moving to the last slide, this is where we really look to the future. And with digital, what's critically important is it's a connected world. And having open standards and open connections across the ecosystem is critical. The example I gave earlier around customers' identity, if we don't have open systems that allow us to pass information across the ecosystem, then we won't be able to share and innovate across this health sector. So it's very important that you can see the interconnections across the providers, the payers, and also the digital technologies that are going to come into this ecosystem over the coming years ahead. And this will allow us to personalize content and services. It will also allow us to manage capacity in the provider environment, drive innovation through preventive care and other measures. So it's a really exciting future ahead of us, and digital is obviously driving the game here. So thanks everybody. It's been wonderful speaking to you, and look forward to seeing you in the future.
Thank you again, Dan. Now let's take a closer look at the technologies that have revolutionized the way we do business.
Good morning. Before I begin, Salesforce, being a publicly listed company, would like to remind our customers that they should base their purchasing decision on Salesforce products and services that are only currently available in the market. We understand it may be a tough period for many businesses right now, so we really would like to thank each and every one of you for spending time to us today in PLDT Digital Convention 2020. Today, we are in the midst of global health crisis, but the reality is that emergencies happen all the time, whether at the local, national, or global. Natural disasters like volcanic eruptions and even earthquakes can wreak havoc on local communities. Crises of public safety can be instantaneous and widespread, or slowly arise over a long period of time. No matter the type or the cause of disaster, organizations must respond accordingly. In talking with our customers, we hear the desire to digitally transform their business to respond to disasters with more speed and efficacy. For example, we've heard organizations ask how they can gather and analyze data in accelerated fashion to inform emergency response plans. We've also heard other customers share their desire to better protect constituents and communities by providing access to emergencies updates. The other common theme we hear is how to quickly receive data, evaluate them, prioritize, and mobilize emergency services. Does any of this resonate with you? To respond to what our customers have shared with us, we decided to take action. Since the beginning of COVID-19 outbreak, we've been fortunate to serve many customers across the globe in their fight to respond to and recover from this pandemic. Using our quick-to-deploy technology, scalable solutions, and innovative thinking, we've helped a variety of organizations across all healthcare, life and sciences, public sector, who are facing their most immediate challenges when they needed it most. Some examples include helping to scale call centers, others about training their employees on how to handle to escalate COVID-19 related questions. Others will also about implementing telehealth solutions to screen patients for COVID-19 symptoms remotely, monitoring and predicting supplies of shortages and reallocating PPEs as needed, and more. As we begin to think what the world will look like as we emerge from COVID-19, we can turn to pandemics of the past to inform our steps forward. From the SARS health crisis, we saw that prevailing tech companies grew stronger in the aftermath. Similarly, customers like healthcare, payers, medical device, and pharmaceutical companies will need to identify their own prevailing trends in the wake of COVID-19 and realign their business priorities accordingly. Once we've recovered and realigned from this pandemic, customers will need to start preparing for their future, and this includes instating a preparedness infrastructure to not only combat the next public health crisis, but to predict it. We in Salesforce have the platform infrastructure to turn this future state into a reality. Going forward, we will work with our customers to better and more proactively enable health using the data available right now. This is why Salesforce launched two solutions for emergency response management last May 19 of this year. One is emergency response management for public health. This includes contact tracing, where you are looking to identify and understand relationships between people, events, places, safely and privately. Then health associates can take actions by conducting targeted health assessment, scheduling care appointments, share educational content, and providing ongoing monitoring. Second solution is the emergency response management for public sector that provides response workers with capabilities to increase collaboration, speed up the emergency request through emergency execution life cycle, while at the same time also supporting emergency response workers in the field. Workers in the field benefit from automated scheduling and visit checklists to improve both productivity and efficacy. Both solutions are powered by Service Cloud, Emergency Program Management, Lightning Scheduler, and Salesforce Map that sits at the center of Salesforce Customer 360. On top of this, we understand the nature of crisis and its impact to the communities is essential for an effective response. Einstein Analytics for Emergency Response Management help users identify health and emergency response by location and time period. That way, organizations can take action on emerging threats and mobilize resources where they're needed most. Constituents also need trusted information during crisis. To control misinformation and fake news, public sector and health authorities need to make trusted information accessible to communities. A central location that supports digital distribution of emergency program details, crisis updates, guided health assessment, may it be via chatbot, and self-emergency requests that will help organizations amplify their reach to help more people who were impacted by this disaster. As I'm about to end, allow me to share the success story of MaxiCare. When COVID-19 struck, MaxiCare's first priority was to take care of their employees and ensure that they could safely continue to work. According to Sylvia Stoke, Chief Digital and Transformation Officer, MaxiCare's employees had to transition from working at MaxiCare facilities to working from home, and MaxiCare used Salesforce Cloud coupled with digital engagement and knowledge article to orchestrate services and ensure continuity of care. MaxiCare's transition to remote work was successful, and as a result, MaxiCare was able to provide uninterrupted care to its members. You can visit MaxiCare's story at the link shared in this slide. If you would like to learn more about Salesforce Emergency Response Management Solution, you can access additional detail on our website, watch a demo, or read our new product datasheet. Thank you for your time. Enjoy the rest of the day and stay safe.
What a great presentation. I hope that segment was as informative and insightful for all of you as it was for me. Again, we would love to hear thoughts and insights. Do key them in the chat box or post them in your respective social media accounts. When doing so, use the official event hashtags #BraceForImpact and #PHDigicon2020. Now here to demonstrate and show us practical applications of various technologies, we're defining how the eHealth sector can collaborate better in the new future of work. Please welcome Industry Solutions Manager of PLDT Enterprise, Mr. Paul Inocencio.
Thank you, Jess. Good morning, ladies and gentlemen, boys and girls of the healthcare industry. In our team, the Industry Solutions team, we take the detective's vantage point in appreciating the challenges and opportunities of each industry intimately, all for the purpose of introducing useful and consequential products that improves lives, products that solves, products that helps and shapes communities. Our healthcare industry lately has been an amplified stage of pioneering products that wants to serve all and be for all. But speaking of ultimate product, we identified three crucial, fundamental, or if I may, three prerequisites in order to serve all and be for all. And that's unparalleled connectivity, touchpoint, and ICT solution, all working hand in hand as crucial enablers of our product. Fortunately, PLDT is structured and founded on these crucial fundamentals. PLDT offers the industry's best fixed connectivity. Smart offers the best data connectivity and wireless touchpoint solutions, while ePLDT is the home of ICT cloud solutions. So what we did is harmoniously blend the strengths and capabilities of these foundations. And with the combined power of these three, we were able to put up the actual product that can enable our healthcare professionals to provide healthcare for all. And I mean all is that we provide a countrywide coverage that does not discriminate. It includes all people, regardless of where they are. So our solution includes different market profiles and specifically catered for our senior communities, for the youth, for the families, for PWD and patients with special condition. When we say healthcare for all, we mean healthcare for all. So again, let me reiterate that in order for a product to reach all, it should comply with these three fundamental requirements. Deliver healthcare for all. And ladies and gentlemen, empowered by the Trinity technology PLDT Smart and ePLDT, may I present to you PLDT eHEALTH, the country's strongest service enabler of healthcare professional. This is the beginning of our ultimate product for the healthcare industry, because this will revolutionize our practice and establish methodologies for our patients and professionals. This will also improve the operations of our hospitals, clinics, and the much needed test and diagnostic centers. And best, this will provide a safer and more convenient way for our patient community to receive healthcare services. So no more stressful traffic, no more long hours, no more waiting hours, no more long lines, and more convenient for our patient and doctors. Now, I have to be very clear. PLDT eHealth is a multifaceted product, a product with many facets. And this one I'm presenting to you is the telemedicine facet. So with PLDT eHealth, our patients and doctors are allowed to communicate through online consultation, quality online consultation. So our patients and even doctors can do advanced booking. Why? Because they can see the calendar of each other, the hospitals, the doctors, the clinics. They can view those calendars and they can place the request for consultation properly. PLDT eHealth also provides online payment. So basically, the patient will not have to go out there and expose themselves. During the consultation, the doctors can also issue digital prescriptions and digital lab referrals. So doctors won't be having the trouble of seeing the patient physically. PLDT eHealth also allows SMS and email notifications in advance to remind you of an upcoming schedule. It's very convenient for everybody, both for doctors, hospital, exclusively for our patient. And more importantly, PLDT eHealth allows good collaboration, peer-to-peer collaborations between hospitals, doctors, clinics, and test centers. Now, with those given capabilities, PLDT eHealth, we are very obvious in the convenience and the benefits that we can see once these capabilities are established. We will be able now to have 24/7 service, specifically for those emergency calls that, of course, you cannot expect. These are all of a sudden. We will be able to cross beyond the limits of the hospital place or of our physical clinics, because we will now be able to reach clients who are from very far places. We will be able to alleviate hospital crowding, long lines, of course, unnecessary long lines. And with these capabilities, we will be able to increase transaction frequency. Of course, we're not always looking out for our clients and patients. We're also looking for the business side of the hospitals and the doctors. This will also increase the health protection from both ends, doctors and patient, while also increasing the risk mitigation capabilities of the practice itself. At the end of the day, our doctors, our hospitals will be able to capture a steady influx of patient and clients. Okay, so how does it look like? So in a glance, this is the patient's view. So again, PLDT eHealth is a mobile app. So our patients can log in, and right away, the patients can see the list of doctors. And if you know the doctor, you can click right away and you will be able to do online consultation. Very easy, very easy. The interface is very friendly and intuitive. No long manuals to understand. The doctor can now collect information or provide instruction to the patient even during the call. So again, if you don't know a doctor, but if you have the application, you can select book online appointment, and you can select right away. In the second picture, you can see the hospital, the doctor's office, the clinic, or whatever is registered in the list there, then you can click that particular establishment, and right away you will be able to see the calendar. So this is a good feature to be able to see the calendar and the schedule of those offices. So right there and then you can already choose from that calendar when would you like to have that online consultation. Very convenient. Now, this one is for the doctors. This is for the professionals. This is their perspective. So first and foremost, the doctor should activate their online consultation features for them to be seen by the patients. Otherwise, if the doctor doesn't want patients calling them in a whim, they can deactivate that particular button. And then if a call comes, the doctor can accept and check, and right away the doctor can see patient history, medical history. If there is, if there's none, the doctor can already create patient information even during the call. So if the patient wants to schedule, then the doctor has a view of his calendar, and from that view, the doctor may or may not approve the patient requesting for that particular schedule. So right away, again, the doctor during the consultation may or may not view the patient history, the patient medical history. At the same time, the doctor can right away issue their digital prescription or an e-lab referral. So we prepared a very short video for us to explore more of the product. So here's the video. So after we saw the video, so right here, what we have here is the patient journey, or if I may, the patient experience. So right away, there are two paths to begin. Now, again, as I've mentioned beforehand, this is very specific and inclusive of all market segments. The upper path is the assisted path, which means you may start by calling the hotline of the hospital. and the triage nurse will accommodate you and lead you to the online consultation. Otherwise, if the patient does have the application, the patient may do what we showed earlier, can register, log in, see and search for the doctor for the hospital, and then book a schedule. So the third step is the converging path, which leads to the teleconsult or the teleconsultation. So this will have the doctor see the patient online and give proper instructions, examine the patient, whatever the doctor needs to do with the patient. So right or during the consultation, the doctor may issue already the digital prescription with which the doctor may send through email or through the chat, through the app. Now, after that, of course, the patient already having the digital prescription may send that digital prescription through the Choice Drugstore online, or he can just go there and purchase it. Anyway, our pharmacies and drugstores are already accepting those digital copies right away. And lastly, doctors may issue online laboratory referrals, so that patients will no longer need to again physically go to those laboratories, diagnostic centers, fill up those forms, get those numbers, long queues, etc. All they need to do is to register in advance, book in advance, and they'll only go there if they have to be on the test itself. So PLDT eHealth is not just a mobile application for patients. It is also a mobile application for doctors, for hospitals, for clinics, and of course, the much needed diagnostics and test centers. So all in all, this is a multifaceted product backed by an ecosystem of technology-driven parties working hand in hand to deliver the ultimate healthcare experience. So this is not just one license or one mobile app alone. Okay, so all that I have mentioned is on the ICT cloud. Now let me breeze you through the other important components, which is from PLDT and Smart. So for PLDT, our hospitals need strong connections, strong and stable connections. So PLDT positions beyond fiber solution. So this is an all-in-one digital solution that will enable business of any size capable of providing strong and stable connection. Of course, our hospital and specific diagnostic centers cannot afford downtime and sluggish connection, because downtime might mean patient loss of time and even lives. So Beyond Fiber is the best in the industry. So let's equip our hospitals and test center with Wi-Fi, which is best and strongest in the industry, and with the strongest capability to connect faster, longer, and better. PLDT also offers, if you may recall, we have this particular path wherein the patient needs to call the hotline. So PLDT also offers contact center as a service solution. This is a unified platform that organizes all your channels for voice, which is the one calling, email, chats, text messages, SMS, web chats, and even social media into a single point of manageable platform, so that your call centers or your agent or the particular reception can happily and conveniently organize all incoming communication. So all that said about communication, exchanges of patient information and data, of course, PLDT provides security operations center solution that whether you're in a medical or in any industry, you can be secured, you can be assured that your infrastructure will be safe, that your data, personal information will be safe with this particular service solution that will not only enhance your security, but will also enhance your practice, your organization's practice of handling very important data and information. Now, for Smart, of course, there's fixed connectivity, which is PLDT, and now we have wireless connectivity and touchpoint. So Smart offers the best in terms of class, the greatest bundle of data and device plan. So of course, Smart's LTE expansion rollout equips our health workers with the best backbone of wireless connectivity. powered by 21,000 4G and LTE sites, empowering our healthcare and frontliners. We have handpicked a mix of wireless, postpaid, and broadband plans specifically catered for the lifestyle of our doctors and frontliners. Now we have PLDT, we have Smart, now we're going to ePLDT. So with ePLDT, since this is an ICT company, an ICT cloud company, ePLDT offers a good solution, a good list of solutions for our healthcare professionals to augment their capability. And one of those are collaboration tools. So we have G Suite for the simplified and straightforward tools for doctors and experts who means business, who's not looking for any drama in order to make collaboration with their peers more holistic, more productive, more efficient, like sharing reports, co-authoring any documents. So this is G Suite. While if a particular client, hospital, is more of a Microsoft user, ePLDT offers at the same time Office 365 for a more familiar look, and for patients, for hospitals and clients and clinics who are using Office 365 already for their collaboration. Now, with all things I mentioned, important products and services, at the end of the day, what we intend is not to take away the limelight by introducing a super product or the ultimate product. What we envision is to make our doctors, our healthcare professionals, our hospital, their game plans one level up, and for them to get ahead of the curve, for them to get ahead of the challenges that's coming. So this product is a product that will allow you to meet your patient even if you're not there physically. So this product will allow you to deliver that much needed healthcare services everywhere, anytime. So the PLDT group, and with this product, complex problems are, of course, simplified by the solutions that we provide. And if that happens, the services becomes more personalized. And if our services becomes more personalized, the patient community, whether senior, a young person, or anybody in the family, will become more happy. They become more happier. They become more healthier and more compliant. So, PLDT eHealth is the country's strongest service enabler for the healthcare industry. Ladies and gentlemen, I invite you to level up your game, engage, solve, and take the lead with PLDT eHealth, powered by PLDT, Smart, ePLDT, and the rest of our ICT solutions partner. So before I end, I want to make this very clear with everyone. No organization, no person will ever make the absolute perfect product. Not us, not our competition. Why? Because here at PLDT Group, we believe that the ultimate solution to our problem, to the industry's problem, is you. Our doctors, the nurses, the healthcare workers, our frontliners, and all the support groups working hand in hand to solve this. PLDT eHealth was built from the ground up based on this idea, because PLDT eHealth is designed to make you perform more, to make you do better, do more, and be at your best all the time. This is Paul Inocencio from Industry Solutions team of ePLDT, and PLDT eHealth is your go-to product in delivering that healthcare for all. Thank you, and I'm looking forward to everyone in our Q&A portion.
Thank you for a very informative presentation, Paul. And now here's a glimpse of various tools and technologies that are redefining the way we do business.
Good morning. My name is Ravi Kailat with Nokia. And thank you so much for the opportunity to be here with you virtually at DigiCon 2020 and to be able to share Nokia's view on how broadband can make a fundamental impact to an essential industry like healthcare services. In today's COVID-19 world, we have seen our medical system stretched. Critically, we have seen our caregivers exposed like never before. Using broadband can make a massive impact in how we deliver these services. There have been studies all over the world, and one particular study in the United States shows that today there are between 250,000 to 400,000 deaths occurring due to medical errors and due to communication delays. It also happens when information is lost when transferred between different stakeholders. Why is this happening? This is largely happening due to a non-availability of a broadband network that's pervasive in campus and outside campus, relying on a mobile broadband technology. Can this be resolved? Yes, this can be done based on today's 4G LTE networks and future 5G networks. This can be done because these networks can deliver high amounts of data with extreme quality and can meet the mission critical requirements of a healthcare service. Additionally, using analytics tools and an operation center environment can link all the data streams together and provide a cohesive view of a patient's situation to all relevant stakeholders. After all, it's all about saving lives. Nokia firmly believes that using broadband in healthcare services will have a fundamental impact in 3 dimensions. The first is time saved. We need to be able to find a way to get to the patients quickly and also to get the patients to the caregiving facility quickly. Using a connected system ensures that always the patient or the caregiver is routed in the most efficient way to the particular facility. It also enables with large amounts of data transfer to be able to save time in getting data to the caregiver about the patient's history and condition. The second aspect is about improving safety. Our caregivers are exposed, as well as a certain group of our population. Using technology based on IoT and sensors, we are able to read the vital signs of both our caregivers and our population to be able to proactively manage any health crisis. This ensures that we are able to deliver these services in a safe environment. And finally, it's about maximizing efficiency. If we are able to use technologies like augmented reality and virtual reality to connect a patient to a caregiver, we are able to be a lot more efficient in the usage of time. There is also no loss of information when all systems are connected and brought together with the right set of analytics and an operation center environment. As a first step, and inspired by what has happened due to COVID-19, Nokia released a Nokia Analytics automated solution. What this solution does is using thermal cameras which are available to run analytics on the data coming out of these cameras to detect elevated temperatures. This is a first step to be able to ensure that we are able to take actions based on certain workflows established in an operation center to be able to send that particular individual to a right area. Also, using scene analytics, we are also able to make sure that people are maintaining the appropriate social distancing. Also, in today's world, mask wearing has become a norm. This system can be enhanced to also detect if a face mask is being worn. Essentially, Nokia has brought its unmatched end-to-end capability to be able to address a fundamental problem our society is facing today. The solution has been designed to be rapid and quickly deployable. It has also been designed to be extensible. This is extremely important in a hospital environment where we need to rapidly deploy such kind of solutions, change its locations, and use it in a way that it seems fit for that. including further enhancing it to create new use cases. Let's take an additional case where broadband can make a fundamental impact. A connected ambulance. Nokia had the opportunity to demonstrate such a solution in the Middle East. What a connected ambulance enables is to be able to route the patient correctly to the right facility quickly, but critically using broadband connectivity with high bandwidth and low latency to be able to provide data about the patient on the go. This data could be made available to multiple stakeholders, including a specialist in a hospital center, where using augmented reality, virtual reality, care can be provided while the patient is still in transit. This saves a lot of time and in the end will save a lot of lives. To summarize, Nokia sees using broadband to have a fundamental impact in 3 dimensions. One is to make our healthcare services smarter, using all the digitization capability that we have. It enables a quicker response to emergency services that may be required. Activation of the response system will be quicker based on digital data that has been analyzed and provided to all the relevant stakeholders. Finally, with information being available seamlessly across all the stakeholders with consistency also ensures that we have better patient care, and with the secure data management we are able to make sure that the right care is provided rapidly. Thank you very much for the opportunity to be able to share a small snapshot of what Nokia sees broadband making a fundamental impact to us.
Thank you to our dear partners for your presentation. Indeed, there's so much that enterprises, large or small, can do with the solutions and technologies we have today. So let's hear what some of them have to say and what they look forward to with our services. Let us all welcome Vice President for Information and Communication Technology of Makati Medical Center, Mr. Christian Sumabat.
Good morning. I'm delighted to share our experience and how we evolved to make an impact on the front lines of the pandemic. Our mission is to provide the highest quality healthcare experience through superior service delivery, technology, and digital innovations. Makati Med has prepared for situations like this, coming from our experience with SARS and MERS years back. We have successfully deployed digital innovations to maintain and improve our care despite the challenges of this pandemic, from the use of telemedicine, video conferencing, remote care services, online payments, and paperless transactions. Part of our challenge was to ensure that our healthcare teams can communicate and collaborate in a reliable and secure high-tech and high-touch environment. PLDT has provided us with the confidence to continue to scale our bandwidth and strengthen our cybersecurity to provide quality care while minimizing our data privacy and cybersecurity risks. We introduced and integrated the use and value of cloud computing, the Internet of Things, business intelligence, and robotics process automation to improve our efficiency and ensure that our doctors, employees, and patients are safe and comfortable. Makati Medical Center continues to be at the forefront of caring for patients, whether in our critical care units, emergency department, or the convenience of their homes and offices. We move from the best hospital care to beyond hospital care as we thrive in our next normal, the healthy normal. Thank you.
Like Mr. Sumabat, we look forward to servicing others like them. And now here's a look at the solutions paving the way for telemedicine.
Good morning, everyone. Thank you for having me. I might focus on critical technologies, reinventing the way businesses operate, but I would like to add more context on health and safety. We all know that health and safety is now a prerequisite before we do business. We provide safety to our employees and customers while doing business at the same time. This is one of the reasons why we relaunched our enhanced and simplified Health in a Box platform, or HealthBox, to assist and provide healthcare technology services to our partners and clients. We also allow our clients to subscribe to this amazing healthcare platform. We also allow our technology partners to resell and white label our solutions to provide seamless and systematized services to their clients. We also aim to stitch up gaps of multiple healthcare solutions by providing them ready solutions and integrations. We're able to embed our digital health ID as well and digital logbook to our HealthBox platform to help establishments and workplaces. There are 6 modules of our HealthBox platform. We use microservices on our modules to make sure each feature can stand alone and can be integrated to any other solutions later on. First module is our hospital and clinic information system. This is to help simplify and organize the operation of a certain clinic or hospital. Second is we have the doctor's management system. So we have to provide our healthcare professionals a tool to manage their own personal operation in the healthcare industry. Third, we have the patient portal and mobile app. This is an app that can help patients to have their own telehealth modules to provide contactless and cashless transactions, including online appointment and online consultation. We also have the pharmacy management system. This is also vital to provide simple and effective inventory management system and distribution, and even a door-to-door delivery of medicines and in-home medical services. We also have the wellness or diagnostic centers that can benefit from this platform for them to integrate and promote their services and provide accessible diagnostics and wellness products and services. Lastly, we have the HMO. For the HMO, this is the Health Maintenance Organization modules that can benefit from this innovation as well. So as a software company, we encourage the business sector to embed health and safety solutions while doing their respective businesses. So thank you so much and have a good day.
Thank you to our dear partners for sharing those insights.
Key in your questions, comments, and suggestions via the chat.
And now that you have discovered and learned about the latest technologies and solutions designed to reinvent your businesses, it's time for us to entertain questions. At this point, let me introduce you to our esteemed panelists, beginning with Dr. Enrique Itayag. He is, of course, the Assistant Secretary over at the Department of Health. Good morning, sir.
Good morning, Jess.
And then we also have Cyrus Mewawala. He is the Head of Thematic Research over at Global Data. Great to have you here with us.
Good morning, Jess.
Good morning. And then you also have Daniel Horan. He is a Senior Advisor at Healthcare Metro Pacific Investments Corporation. Great to have you here with us as well, sir.
Good morning.
And then, of course, we have Luigi Casas. He is a Corporate Relationship Management Head over at PLDT Enterprise. Great to have you on board.
Good morning.
Good morning. And then Christian Sumabat as well. He is a Vice President for Information and Communication Technology over at the Makati Medical Center. Good morning.
Morning.
And we have Ravi Kayalat. He's Engagement Head, Enterprise Services at APJ Nokia. Good morning. Great to have you here.
Good morning, and thank you for having me.
All right. And of course, David Almirol. He is a founder and CEO of Multisys. Good morning, Sir David.
Good morning.
And there's also Gerardo Guzman. He is a Regional Senior Manager over at Southeast Asia Service Cloud Business Salesforce. Good morning, sir.
Good morning, Jess.
And Paul Inocencio is the Industry Solutions Manager over at PLDT Enterprise.
Hey everyone, good morning.
All right. Now to all our delegates, do engage with us by typing in your question in the chat box. Now let's start, of course, with our interview portion now here. Starting off with Dr. Tayag. This one is for you, Dr. Tayag. This is coming, of course, from Mr. Ko. He's asking, does PhilHealth have plans to reimburse telemedicine services? And primarily, maybe, really asking what health authorities have in store, at least, to support telemedicine services.
Thank you, Jess, for the question. The COVID-19 pandemic has not spared our country from the impact on our health services and the economy. In fact, dangerous disruption was observed in the health sector, especially on the significant decline in the access to health services. As a silver lining to the pandemic, telemedicine was observed to have increased demand over the weeks and months. And the Department of Health has introduced different models for telemedicine. And right now, PhilHealth does not reimburse for telemedicine, but soon it will be in your neighborhood. When I say in your neighborhood, PhilHealth is now looking at policies that should be implemented when they start reimbursing telemedicine services. And we at the Department of Health are working closely with PhilHealth on this.
All right,
Thank you, Jess.
All right, at least this is something that our delegates at least can look forward to in terms of the support that you are giving to telemedicine services. Now, here we have another question here from Mr. Ko. This one addressed, of course, to Mr. Casas. What can we look forward to on an infrastructure standpoint in telco to support these digital services?
Sorry, let me get off on mute. Thanks, Jess. I think in terms of infrastructure for the past, 2 decades, PLDT has been very consistent in increasing its capex, and those capexes have been really directed at expanding our traffic capacity and diversity, both locally and internationally. So things that we can really look forward to that will really help the healthcare industry. I think on the PLDT front, we are really aggressively rolling out our fiber. We're essentially migrating all copper or legacy lines, and we look to migrate over 30,000 corporate lines and over 200,000 homes by the end of this year. And on the wireless side, I think it's really 5G. I think 5G will play a very big role across all industries, not just in terms of download speeds, but also in the IoT space. So smart homes, smart hospitals, smart clinics, et cetera, et cetera. These are the things that I think we're going to be exciting to see, and that will really help shape the healthcare industry specifically in the next coming months.
All right, definitely lots of things to look forward to, especially when we're talking about 5G and how that, of course, is going to help infrastructure, especially in supporting medical services. Now, related to emerging trends in the healthcare industry, we have received a question from Mr. Lacson. What emerging trends should our doctors and hospitals look out for in order to survive the drastic changes that they are facing? So who from our panelists would like to answer that question?
Yeah, I can take that question.
Sure, Paul.
From our audience. Okay. Well, countryside speaking, now it's very important to take note of the items and products that the pharmaceutical and technology leaders will bring about. So from this year and on, and the coming years. Now, speaking of trends, I'd like to mention remote patient management, wearable devices, and of course, very important, equally important, is the cloud-based applications. Of course, all of these will help to augment and enhance the capabilities of not only of the doctors and practitioners, but at the same time, our institutions, the hospitals. So this will be very important. But I'd also like to make a special mention, since starting this year, I believe even late last year, this particular technology will be very useful, and at the same time, payment gateways. Doctors and hospitals should have a good and flexible option for patients being consulted remotely to have payment options through online or any means. Now, it is very important that while we are improving how we are treating our patients, the medicines, the vaccines, not to mention, that we also improve our capability in terms of technology, in terms of online consultation, in terms of relationship management. That's very important. So I think that's the trend. and that's how it will be for the coming years.
All right, payment gateways. That's a very interesting insight there on how hospitals can really widely adapt that to at least adjust to the new normal here. Now, another question connected to game-changing solutions here. Here's a question, another one from Mr. Ko. What do you think leaders in healthcare providers should move to a connected, collaborative, and personalized solution? We have Mr. Gerard de Guzman. Would you like to answer that question?
Yeah, of course. Thank you, Jess. Basically, the healthcare and life sciences industries have shared the goal of improving the quality of patient care and patient outcome. But in order to meet the expectation of both patients and providers, we must build a stronger economy, stronger ecosystem. That means moving past disconnected, siloed, and uniform system to achieve that goal. Disconnected legacy are not equipped to support patient, customer-centric transformation. New point solutions are even creating more complexity and data silos, making it hard to piece together a complete picture of patient, member, and consumer. Organizations must shift to a more effective, connected ecosystem of solutions and partners, and this strengthens collaborations across departments and care teams that create a 360-degree view and insight to personalize the experience at scale. Thank you, Jess.
All right, so a more collaborative ecosystem, definitely something that our medical services can at least look into. Now, we have received a question as well from Mr. Herman. How do you think the pandemic will change the healthcare landscape in the coming year? I believe Mr. Sumabat can address this.
Yes, thank you. The pandemic has significantly shifted the mindset of a lot of organizations and healthcare providers. So from the topics that were discussed earlier, from IoT, Internet of Things, cloud computing, personalized medicine, so all of these will evolve and emerge into the landscape. And I believe that part of that, aside from being high tech, the mindset of the business executives, the healthcare executives, should also shift towards a more receptive perspective of technology, right? In the past, the role of IT in the organization is just to connect, make sure that you have your workstations running and working. But now it has significantly evolved towards keeping and maintaining the relationship between the healthcare organization, the healthcare providers, and the patients. And we will continue to see more of that, not just next year, but in the years to come, post-pandemic.
Mm-hmm. So definitely a more receptive technology here for the medical sector here. Now, just another question from one of our engaged delegates here, Mr. Lacson. He's asking, what are the options available to healthcare facilities to implement these broadband technology solutions? This, I believe, is a perfect question for you to answer, Mr. Ravi Kailat.
Thank you very much for the question. The importance of healthcare as a basic right has been highlighted even more in the current environment of COVID-19. Aiming to provide the best-in-class technologies for our frontline caregivers will enable services to be provided rapidly, with accuracy, and with safety. Healthcare facilities should aim to make digitization of their assets a core business requirement and make it part of their operations blueprint. As an example, Nokia provides solutions like our Integrated Operations Center, or IOC, which would help healthcare facilities begin the journey with a centralized center for managing all digital operations and data flows from both large and small sensors and devices, enabling IoT and then breaking down silos across departments, minimizing information handover. This also includes proactive monitoring, which is very key in preventive healthcare. On top of this, automated monitoring solutions are available to capture elevated temperatures and wearing of masks and trigger actions automatically, which will again improve safety of processing of patients. Utilizing and accessing broadband extensive via partners like PLDT, either through their commercial network or via private networks, will enable seamless connectivity using fiber, 4G or 5G inside and outside the facilities. This offers wide footprint. PLDT's local presence also ensures that any complexity of managing these systems is taken away from the healthcare facilities and allowing them to focus on what they do best, which is to serve the public and to enable the country to be healthy and productive. Thank you.
All right, digitization and automation as part of the business's core so that at least you can focus on providing healthcare services. Very great insight there. Now for our next question, it's addressed to you, Mr. Almirol. Since Multisys just launched the platform recently, what can we expect from HealthBox to help the healthcare industry?
Yes, Jess, our Health in a Box or the HealthBox platform was originally designed as an end-to-end solution for hospitals and clinics, but we're able to simplify the solution to focus on health plus safety-centric solution to assist more our clients and partners in the healthcare industry. With our current partnership, of course, with PLDT and several partners, we aim to open this lighter but cheaper version to the healthcare industry to help more people and assist industry stakeholders for efficient healthcare solutions such as e-consultation with online appointment, e-medical records integration, e-billing and e-payment, that's what discussed a while ago, e-pharmacy and e-delivery services. We're able to sign agreement with the biggest pharmaceutical company also in the country. And we're adding more exciting e-health benefits as well to our citizens. So that's the HealthBox platform.
All right, definitely lots of exciting features that the medical sector can at least look forward to with HealthBox there. Now, we receive another question from Mr. Herman. This time around, where do you see telehealth services heading in the Philippines? Dan, you may have a word or two about this one.
Yes, thank you. Great question. Well, as you probably have seen, telehealth services are really growing rapidly in the Philippines. But ultimately, they're only about 1% of the total consults in the country, which is about 160 million today, as you can imagine. So it's a huge number, and the opportunity for us to shift into this space is very large. Now, today, what you'll also see is that most of the consults are very transactionally based. At Metro Pacific, what we're focused on building out is an integrated solution that allows us to bring together the physical and the virtual services into something which is defines a much better health outcome for the patients. The sorts of services that we envisage that would come into this space are things like triage, so digital triaging, chronic disease management programs, and more from preventive care purposes and health and wellness as well. So these are all ecosystem-based services, and for us, what's very important in the telehealth space is that as an organization and as a platform, it's open to all to come in and it's inclusive, so that we drive a certain type of solution that brings together an integrated experience for the customers, the patients, and also the providers of the solutions as well.
All right, a huge untapped market that presents a lot of opportunities. Thank you, Dan. Okay, up next we have a question from Mrs. Aguida. She's asking, which emerging technologies are likely to be the most disruptive for healthcare companies in the medium term? I think Mr. Mewawala can answer this.
Thanks, Jess. Yeah, I think what we've seen in COVID-19 is that telemedicine has been truly transformative. It's given healthcare access to more people, and it's made healthcare more affordable. But looking forward into the medium term, I think the truly disruptive, truly transformational technology is going to be big data combined with genomics that moves us into an era of precision medicine. So if you go back 15 years, in 2006, the cost of sequencing a human genome was over $1 million. It's now fallen to under $1,000 and is heading towards 100. And what that means is the whole nature of drug development will change from biology and chemistry and move towards data analytics.
Okay, data analytics changing the game here. And now for our closing question. Anyone from you can answer this one. How can key industry stakeholders better work together to improve the healthcare sector, and what are some immediate steps they can take to elevate the sector's capabilities?
Oh, yes. Can I answer
Go ahead,
that?
Dr. Taig, of course.
Okay, thank you, Jess. In fact, we'd like to thank PLDT because when we launched the DOH COVID-19 hotline, they came to our rescue, and from then we were able to introduce the telemedicine platform. It has morphed into more models for telemedicine, like the subscription model, where we are now implementing a community-based, which is linked to the electronic medical record system in Quezon City, and soon in many cities in Metro Manila and outside Metro Manila. And we think of it as a partnership. The DOH cannot do this alone, and working together with companies such as PLDT has afforded us an opportunity to look at innovation and technology in a different way. Thank you, Jess.
All right, anybody else from our panel, of course, you guys can chime in and give us your insights on this one.
So let me give you our point of view on that one, Jess. So they say disconnected systems are creating a divide. Therefore, I believe the answer to this question is the integration of healthcare ecosystem. COVID-19 has fundamentally changed the way this organization operate now and in the future. The pandemic has accelerated the digital imperative and reinforced the need to put patient at the center of every interaction to be able to provide a connected experience. I believe that the sector should invest and take a look at the value. First is people, second is process, and then third is technology. People, there's no question that we have the best resources who can help the sector to improve the current situation. We just need to ensure that we put the right people who are fit in the job. Process, we always need to find a way how we can improve the process. If the process will require us 5 steps to provide service, we need to make it at least 3 steps or less. Third is technology. Invest in technology that can immediately provide you an MVP, or what we call minimum viable product. A platform that we can use immediately and provide value to the end customer or end consumer, to the end user, and last is, of course, to your investment. Thank you, Jess.
All right, so definitely a collaborative environment here, a lot of factors to consider as well. Anybody else from our panel?
Yes, Jess, I can add to that. In terms of the healthcare sector, I think we should focus more on integration and collaboration, because as a software programmer myself, the only way to organize this, so many integration levels in the healthcare industry, I think a seamless way to do this is to come up with a unified integration. And while we're focusing on providing outstanding service to our stakeholders and clients, I think the process for patients and customers, the hospital and doctors, can attain into a time, to avoid like time-consuming processes such as filing of documents manually. And we have to dedicate also better experience with faster check-ins, remote health monitoring maybe, or integration of HMOs and pharmaceutical distributors. This will take a turn for efficient healthcare solutions. Jess, thank you.
So definitely a unified integration for the health sector is something that they can at least envision at least, or focus on to at least help better their services that they are providing, of course, to the public. Again, thank you very much, guys, for the insights that you've given us this morning. Definitely, I would definitely be certain that our delegates are going to take a lot from this session. Thank you. Now, at this point, we would like to thank our presenters and panelists for spending this memorable afternoon with us. Special thanks to our official event partners. Now, to all our delegates, thank you all for tuning in. Again, you can get a chance to win exciting raffle prizes just by answering our feedback form that will be flashed on your screens after the program. Once again, I am Jess De Los Santos, and this has been the eHealth Breakout session of the Philippine Digital Convention 2020, brought to you by PLDT Enterprise, Smart, and ePLDT, and co-presented by Salesforce and Multisys.